Today we are going to discuss about such a pathological condition in which majority of the global population is suffering. Surprisingly, in every 15 minutes, one people is dying in this cardiovascular pathology. And globally, 19.8 million people are now suffering from the variety of the cardiovascular pathologies. Prior to the deeper discussion on the cardiovascular pathologies, let's take a short discussion about the arterial anatomy of heart. As the image displaying or as the diagram is there, this is our heart. That is the main pumping organ, which is also known as vasa vasorum. And this diagram is showing the anterior surface of the heart, and the dotted lines are displaying the posterior part of the heart. Now, this particular area is known as right auricle. Why the auricle term is coined? Because auricle means ear-like structure, and this structure resembles human ear. That's why it is known as auricle. Now, behind the right auricle, you have your aortic sinus of Valsalva, which is at the base of ascending aorta, followed by arch of aorta, and followed by descending thoracic aorta. Now, when this aortic sinus of Valsalva is there, from this aortic sinus, two arteries are originating. The main two arteries which are supplying your heart. Number one is the right coronary artery, and number two is the left coronary artery. As the diagram suggests, the left coronary artery is much more branched than the right coronary artery. In case of right coronary artery, we can see it is divided into basically two parts. This is the main trunk of the right coronary artery, and this one is your right marginal artery. As in the anterior surface, we have our right anterior descending coronary artery. In the posterior side, we have our right posterior descending coronary artery. Now, whenever this right coronary artery is the point of discussion, we should consider this image or this diagram. This is the origin of right coronary artery, and it is a C-like structure. And at the very beginning, we have our conal branch, or it is known as the first branch. It is also known as the third coronary artery. And this conal branch is supplying the infundibulum of right ventricle. Next is our SA nodal branch. That is the branch which is supplying the sinoatrial node, which is also known as the pacemaker of heart. And this SA nodal branch is supplying SA node along with Bachmann's bundle, crista terminalis, and free wall of right atrium. Next, this one, it is the branch to the right ventricle. This one, which is like the carved C having two ends, this is the branch for the right ventricle. Next, followed by this area, we have our distal part. Prior to that, we should consider this part is known as proximal, followed by the straight part of the C is known as middle, and the horizontal part of the C is known as the distal part of the right coronary artery. And this one is known as acute marginal artery. This acute marginal artery is one of the largest branch of right coronary artery, and it is going to supply the lateral wall of right ventricle. Next is this branch, which is known as AV nodal artery. As you see that it arises from the U-shaped segments, and it is going to supply the atrioventricular node and adjacent structures, and it is finally going to terminate at the apex of triangle of Koch. Now, after the discussion with this right coronary artery, we should consider the left coronary artery. As this diagram suggests, it is much more branched, and you can see this part is known as our left main coronary artery. Left main coronary artery, followed by left main coronary artery is bifurcating into the left anterior descending coronary artery and left circumflex artery. Now, this left anterior descending coronary artery is giving diagonal branches and obtuse marginal branches. There are a number of diagonal branches. The diagonal branches are supplying the anterolateral wall of the left ventricle, and these are the septal perforators. This is one of the septal perforator, this is the second, and this is the third. And these septal perforators are supplying the anterior two-thirds of the muscular part of the interventricular septum. Now, just like the right coronary artery, our left coronary artery also having three parts: proximal, middle, and distal. From the origin of left anterior descending coronary artery to the first diagonal branch, this is our proximal part. Next, from the first septal perforators, this is our proximal part. From the first perforators to the terminal perforators, this is our middle part, middle 1/3, and after the part till the end of the our left anterior descending coronary artery, this is our distal 1/3. So the left coronary artery is divided into three parts. One is your proximal, second one is your middle, and third one is your distal part. And as you can see, the D, it is representing the distal, and these are the septal perforators. And in case of left circumflex artery, we have our obtuse marginal branches. Now, let's consider this tabular form. The aortic sinus of Valsalva is giving two branches: left coronary, right coronary. Left coronary is divided into three parts: left anterior descending, left circumflex, and left posterior descending. Left anterior descending arteries are now giving the diagonal branches, which is going to supply the anterior wall of the left ventricle. Left circumflex artery is giving the marginal branches, which is going to supply the free wall of the left ventricle. Left posterior descending artery, which is dividing into two parts. One is going to supply the posterior wall, another is going to supply the inferior wall of the left ventricle. Now, when the right coronary artery is considered, right coronary artery is divided into two parts: right posterior descending and marginal branches. The marginal branches are supplying the right ventricle, whereas the right posterior descending coronary artery is supplying the posterior wall and inferior wall of the left ventricle, just similar as the left coronary artery. So this is in a nutshell of the coronary arterial anatomy. And an interesting thing is there in the diagram, that is this part. And similarly, these interconnections between the conal branch and the left main coronary artery. This is known as basically our Vuessen's ring. What is this Vuessen's ring? This Vuessen's ring is not the normal anatomical structure. It is the natural collateral circulation where the total occlusion of the coronary artery is there. Whenever this coronary total occlusion is there, that is our CTO, this collateral circulation is naturally developed to compensate the myocardium, to compensate the myocardial cells, so that it can operate in a natural way, in a healthy way.